Good day, everyone. I am Gina Espinosa. My batchmates know me as Gina, and I'm an old girl from batch 96. I am currently a physical and rehabilitation medicine specialist and pain medicine specialist at the Philippine Orthopedic Center. I have lots of topics that I would like to share to all of you, but first I will discuss approach to fall prevention, which is very important for the older population. So falls is a common and a serious health problem with devastating consequences. It can be prevented through several evidence-based interventions. Identifying at-risk patients is the most important part of the management. From the WHO, a fall is an event which results in a person coming to rest inadvertently on the ground or floor or other lower level. So usually it is an unintentional loss of balance, failure of postural stability, sudden and unexpected change in position, which results in landing on the floor, and usually not a consequence of violent blow, a loss of consciousness, a paralysis, or a seizure. So what are the facts that we know about falls? At 65 years old and above, 1 in 3 will fall per year, and 50% will fall repeatedly. Fall is one of the most common cause of injury, and it is one of the top leading causes of death for seniors. Statistics show that an older adult falls every second of every day. 1 in 4 older adults reported to have a fall, and falls are the number one cause of fractures in the older population, and usually hip fractures. Other facts that we know is that women are 3 times more likely than men to be hospitalized for a fall. Frequency of falls increases with age and frailty. So when you say being frail, it's a condition of being very weak and very delicate. So there are prerequisites of normal gait and balance, and these are coordination of musculoskeletal structures, processing of sensory information and from the environment, and adequate cognition and concentration. So the ability to control balance during activities of daily living is very, very important. But in older adults, it is impaired and may be impaired due to the deterioration of the musculoskeletal system, the sensory system, and also the cognitive system. Now, the question is, why do older people fall? So number one, it's because of posture changes. So when you grow older, there is decreased range of motion of the upper extremities and the lower extremities, meaning you are not able to move your arms and lower legs freely, unlike when you were a lot younger. So there is loss of spinal flexibility, and we see our older people being flexed and in a stoop posture. So there is compensatory shift in the vertical displacement of the center of the body of mass. Another reason why people fall is due to gait changes. So when you say gait, it is a manner or a pattern of walking and usually involves balance and coordination. So there is loss of symmetry of movement. There is difficulty initiating or maintaining a gait. There is short step length. Walking is usually slow. Falling is usually backwards. And sometimes there is quickening of steps to avoid falling forward. So a direction of fall is a relevant predictor for the mechanism of recurrent falls. So when you see a person having a freezing gait and then falling forward, then probably this patient has a Parkinson's disease. But when you see a patient falling sideways or backwards, then this person probably has a postural instability. So where are people most likely to have a fall? So from studies, it was shown that nursing homes, public places, and homes, our homes are the places that people are most likely to fall. And from this pyramid, you would see that home still is the number one place where people are most likely to fall. So what is the present and current situation? So when you are very fearful, you limit your activity. With limited activity, you have reduced mobility. And in turn, you have a loss of physical fitness and increased risk of falling. So when these cycles go on and on without any intervention being done, then a person may have a probable high risk of fall. So falls do not happen without any reason, and it usually occurs due to the interaction and interplay of multiple risk factors. So there are intrinsic and extrinsic risk factors. When you say intrinsic, it is non-modifiable and cannot be changed. And when you say extrinsic, it is modifiable and can be changed eventually. So for intrinsic, you have the biological and behavioral, which are changes due to aging. For the extrinsic, you have the home and public place hazards, which are environmental factors. So we go deeper into it. The intrinsic and biological risk factors are the following. So age-related sensory changes, which is poor hearing and vision, changes in mental alertness like cognitive impairments, dementia, and depression. Mobility problems like slow reflexes, muscle weakness, and joint stiffness. Chronic illnesses like stroke, Parkinson's disease, diabetes mellitus, and hypertension or kidney diseases. Pain and acute illness like osteoarthritis and low back pain. So all these may lead to fall eventually. So what are the behavioral risk factors? So we have poor eating habits. So when you grow older, there is usually decreased appetite and the sense of taste fades. With poor nutrition, poor eating habits, you have muscle weakness and eventually a risk for falling. Inappropriate footwear, so ill-fitting shoes and worn-out shoes. Refusal to use assistive devices for added support. Alcohol consumption, so social drinking is acceptable, but taking too much alcohol for the older population, this may impair their balance and coordination. Another is multiple medication, especially when you have a chronic illness. So always check your physician if the medications you are taking are still appropriate for you. And sometimes we are guilty of taking supplements and vitamins given by our relatives and friends because they are very popular medications. So better check with your physicians first. So behavioral intrinsic risk factors that are common right now. One is the risk-taking behavior, and these are climbing ladders. So our lolos and dads are very guilty of this. So sometimes they climb up ladders just to fix something on the roof or the wall. So this behavior and action should be delegated already to the young ones. So if you want to reach above or you want to reach something above or high up, you automatically stand on an unsteady chair, not knowing that you could fall eventually. Sometimes you want to grab something or get something on the floor and you automatically bend, not knowing that this is a very unstable position and you may fall forward. So we go to extrinsic risk factors for fall, and these are the home hazards. First is insufficient lighting. So make sure all the bulbs and lightings at home are working very well. We have steps at home which are very high and very narrow. Sometimes you may miss a step and eventually fall. We also have rugs and mattresses at home. Make sure to keep them very secure to avoid slipping. Clutter. So we are all guilty of having so many things at home. Just make sure to tidy them up. Pack away your things so that you will not fall eventually due to those clutters. So public place hazards are also intrinsic risk factors. Number one is the stairs with no railings. So sometimes it's very nice to see and very artistic to see that the stairs has no railings, but very dangerous for older population because they have nothing to hold on to. So slippery floor. Sometimes also it's very nice to see floors that are very shiny, but it's very slippery, especially when it's wet. So outdoors, if you have crack and uneven pathways, this is a potential for falling eventually. And poor lighting again. So for stairways, hallways, and other places with poor lighting, another potential for falling. So what can you do about it? Do you want to do something about it, or are you just going to listen? So here are some tips and reminders to prevent falling eventually. So check your vision and hearing, check your medications, and review them with your physician. Make your home a safer place to live in. Exercise for strength and balance, and always ask for help. If you want to rearrange something at home, you always ask for help. If you want to reach something above, ask for help. So do not be afraid to ask for help. So what are the tips to prevent fall at home? First one is to improve your lighting. Next is to use a grab bar at home so you have something to hold on to. Secure rugs and flooring to avoid slipping. You minimize the clutter and cords and keep materials away from walkways. Make your items very accessible. So keep necessities within easy reach, and it should be placed between the waist and the shoulder and not above, because reaching above will make you very unstable. Always wear proper footwear. So not too high and not too flat, not too ill-fitting and not too loose. So a height probably of 1/2 inch to 1 inch is a appropriate height for everyone. So if you have dogs at home, make sure to secure them. So check around you to see where your pets are before walking, especially on steps and doorways. And if your pet is very strong or very powerful, that it can push or pull you, so always ask for help if you want to walk them. So exercise is very important to have a better balance. So here are some exercises. Side leg raise, you grab hold onto a stable chair and raise your leg sideways. Do this repeatedly and do it to the other leg. Also with back leg raise, you try to hold on to a stable chair and then raise your leg backwards and do this for the other leg also. Marching in place is very simple to do yet very important. Rock the boat, this is what we call the weight shifting exercises. So you put your weight on one foot or leg and then shift it to the other one and do it repeatedly. Sit to stand, sit on a stable chair and then stand and sit again and do it repeatedly as many times as you can. Balancing on one leg, so you grab hold onto a stable chair or table, lift your leg, and then keep that position for a few seconds and do it to the other leg also. And lastly, side twist. So you sit on a stable chair, you move your upper trunk sideways from left to right, and then you can do this also while in standing position. So you can see from this discussion that falls are very preventable. So identifying the risks and applying preventive interventions can play a significant role in reducing the risk of falls. So stop falls before they stop you. So do something right now and turn your knowledge into action. So you speak up always, you check your eyes and your hearing, you keep moving and make your home a safer place to live in. So with that, thank you very much. Maraming salamat po and God bless to everyone.